It's Deborah Fay here from Disruptive Publishing, and we're pleased to welcome you to another episode of The Disruptive Author. And today I have Rosemary Walters with me. Welcome, Rosemary.
Thanks, Deb.
We are excited to announce the newly published book, Biomagnetism Healing, Will It Work for You? Now, this is a story, a book of hope by Rosemary Walters. And Rosemary's here with me today just to talk about how this came about and what it's about and where she's going to be going with it. So I'm excited to explore that with her and share that with you. So, Rosemary, let's just start with biomagnetism healing. What is that?
Oh, it's a beautiful therapy that is highly effective in curing or helping to cure any number of illnesses and unwellnesses. It works using static magnets, so a little bit stronger than your fridge magnet, but just a static magnet placed in specific places in pairs of two or groups of two that are in reversed polarity. So the north on one side and the south on the other. And it neutralizes the pH imbalance in our body. So if there's any part of our body that's in an imbalance, for example, the liver, stomach, shoulder, anywhere, we have specific pairs placed in specific areas that neutralize that balance and allow our body to then heal.
Amazing. That just sounds fascinating. And it's not something that I've certainly come across before. And I've looked at all sorts of therapies and things in the past, alternative, mainstream, and I've always just been very interested in health. So it's been fascinating for me to work with you. How did you come across it?
Yeah, it's very new to Australia. It originated by an amazing medical doctor in Mexico, Dr. Goiz Durán. And so it's very prominent in South America and Spanish-speaking countries, but quite new to the English-speaking world. And he developed it in 1988. I came across it when I had a lump grow rather suddenly in my breast, and I asked, any powers that be to guide me to someone who could help me deal with this situation, because I needed someone more or something more powerful than what I already knew. And like you, I'd been interested in lots of alternative and mainstream healing things. I had bad eczema when I was a child, and nothing really helped. And so those sorts of things that you can't get rid of, those little niggly things that aren't life-threatening. Anyway, I ran into a lady called Lisa Bruff, who is a practitioner of biomagnetism in Redcliffe in Queensland.
Okay. Good.
And it's beautiful. And within 6 weeks, my tumor, which I've got quite small breasts, it was very, very obvious. It had shrunk by half because it was very large. It was probably 2 inches long, and it shrunk down to about 1 inch within 5 treatments, so 4 weekly treatments and a fortnightly treatment.
That's incredible. That's incredible.
Yeah.
And that must have been so relieving for you to actually see the change, the positive, in a positive direction.
Yeah, and at the time I didn't even know it was cancer. I thought, it might be a cyst or something. I suppose there was something in the back of my mind that thought, probably, I don't know. But the fact that it grew so quickly, I didn't know cancer could grow that quickly. I just didn't know that you could wake up one morning and have, a 2-inch lump in your breast. So anyway, it gave me a lot of hope, because I just didn't really, at the time, I didn't really understand the enormity of what was happening. And then I went through some conventional treatments, and even
you would
now,
have diagnosis then before the conventional treatments?
So after it had shrunk by half, I then went to the doctor because it had stabilized for a couple of weeks. Okay. And I thought, maybe this is as far as this will take me. I wasn't really sure. There's still part of the back of my mind that niggles as to whether, if I just kept going, could I have got rid of it? But it's nothing to muck around with cancer. You can't just sort of, some people do, but I didn't feel, having a 4-year-old and a 6-year-old at home, that I could just wait and see. So
You just want
I
to be
went.
sure you're covering all bases, don't you? If if you're determined to be at your best. Yeah. Mm,
Absolutely, yeah.
mm,
And that was all I could feel. Like, who knows what else may have been anywhere else? I wasn't sure.
yeah.
So I went to the doctor, and the processes of biopsies and scans and everything ensued. And so I had surgery. I had two surgeries, then I had chemo, then I had radiation, because there was an epically large volume of cancer there. But I'm very, very
Wow.
grateful of the biomagnetism, because had I have gone to the doctor first,
Hmm.
I mean, they would have had kittens, and I was
Yeah.
I was very reluctant to go through very serious, chemo and radiation. I found it, especially radiation, very confronting, and I felt that it was quite unnecessary, because they'd already cut the cancer out. I,
Yes.
I, I couldn't understand. Like, I
Because some things
understand
don't all make sense.
statistically,
Yeah.
yeah. But I did use biomagnetism all through my healing as well.
Mhm.
You can't use it when you're having chemotherapy and radiation therapy directly, because it's a very strong detoxer, biomagnetism, and it releases more of the because your body can hold chemo in its cells and release it slowly, so as you don't kill yourself with the amount of poison that it has.
Oh, okay. So it's not all immediate, like slow release.
I think so,
Yeah.
in my experience anyway. So
Okay.
probably 11
Yeah.
months after I finished my chemo, I was putting magnets on a little bit too often, because you're advised not to use magnets on your body for about a year, give or take.
Mm.
I used it much earlier, because I had a very good practitioner who knew exactly what she was doing. She'd treated many cancer patients before, very experienced, and I was confident that I could deal with whatever was to come. I knew it wouldn't make me unwell, but this one day it did make me unwell. It was too much
Okay.
of a detox. I used them too many days in a row, and I
Yep.
woke up feeling like I did during chemo. I could taste the chemo. I was shaking. I was vomiting. It was like I felt during chemo, because it must have just released that last bit. I mean, it was a good detox, but it was just a bit much, a bit
Yeah. All at
quickly.
once. Yeah.
Yeah, so you have
Yeah.
to tread carefully.
Oh my. This is all like this is life-changing stuff, what you're talking about, really. I mean, and you're here today. So how long is it since you've had since you finished all your treatments?
Almost 2.5 years since
Mm.
treatment finish, or 2 1/3 years
Okay.
post-treatment. So,
Yeah.
and feeling
And
good,
so I was just going to say, do you still use the biomagnetic treatment to help just to maintain?
Yeah.
Okay. Yeah.
I do personally, but that's also because I can do it myself. But also, once you've had cancer, there's this little niggle in the back of your mind that I never thought that I would have when I was first diagnosed, probably for the first 12 months. But then after that, there's this little niggle of fear of recurrence. And
Okay.
I never
Yeah.
thought I would fear recurrence. I thought, no, I'm done with this. I'm fine. I'm back on deck. I've done all the work, but it's there. It's
Yeah.
definitely niggling away. And if you have a sense of what may have caused your cancer, or one of the elements, often these things are far more complex than a simple. Sometimes they're very simple, but more often than not, they're very complex. If you know that you've got that thing that's triggering you,
Mm,
it's there, and I can feel it. My other breast will ache, or give me a physical sensation. I'm like, oh, okay, I need to go back to Lisa. I do
okay.
treat
Yeah.
myself as well, now that
Yes.
I'm trained. Sometimes
Yeah.
it's easier to get someone else to do it for you, and it's far more
Yeah.
relaxing and delightful. It's a beautiful therapy.
So and so I've heard from not just from you, but from some other people as well, which you cover in the book too. Um, Tell us a little bit about like who were you before biomagnetism? And what sort of person does it take to actually think just outside of the box enough to find something like this?
I always wanted to be a healer. Even as a child, I wanted to be a doctor, but I
Mm,
knew I didn't have the brains to rote learn all of the stuff required. My parents are both
mm,
scientists, But I was also quite good at music. So I grew up to be a music teacher, and that's what I've been doing for the last 25 years. But I always had this interest in alternative therapies and health, things that can get to the root of the issue more so than conventional medicine. And I often had issues with my voice as a younger music teacher, and look, it was overworked, definitely, but there was elements of emotional attachment or release that I needed to find. And so I found EFT, the tapping.
Yes.
Yeah, so I found EFT when I was in my early 20s or mid 20s. And I did a course in that. And so, yeah, these things have just come in and out. I've done a lot of acupuncture. I haven't trained in anything else, but I've dabbled in lots of things to try and heal my voice. I had eczema. And I just, nothing grabbed me enough for me to want to study it until biomagnetism came, and I just went, all right, if you can shift cancer, I'm in.
Oh, look, how could you not have a life-changing experience like that and not be curious to take it further? Seriously, which, I'd love to sort of talk to you about that. But before we move forward with where you want to go, I just want to ask you this question. Having scientists for parents, there must be some sort of a critical mind implanted in you, just by monkey see, monkey do. They're having those role models. So I'm assuming you've approached this, and you always approach these types of things with that critical thinking.
Yeah.
Is that true?
Yes, yeah. I'm quite conventional.
Yeah.
I'd love to study Reiki, but I just haven't yet because I don't really understand it. But I intellectually I understand how it works.
Yes.
But there's So yes, I am. Things have to work, and you have to be able to see it work for me to be able to go there or feel it work. I mean, I've had Reiki treatments and I can feel them, and they're beautiful. But I don't know if Reiki could shift my cancer within 6 weeks. Perhaps. But biomagnetism did on me in my life here in Australia, in Brisbane, in my regular family home with my husband and 2 children. I mean, maybe if you went to some master in Nepal or so, I don't know. It's one of those things, I suppose, for me that there's a lot of research on biomagnetism, not a lot in English. We're in the process of translating and rediscovering documents and studies. People are doing studies, but a lady called Dr. Ruth Myers has just done a study on fibromyalgia and biomagnetism. I mean, that's crippling for so many people.
Oh, so many, yes.
Yeah, and look, her results are outstanding. There's a lot out there. Yeah, yeah. Even for aging, the biomagnetism conference this year has a discussion, a talk presentation on aging and biomagnetism. So, I mean, the range of things
will be a huge market.
Biomagnetism can help with is phenomenal. Things that Western medicine struggle with sometimes, like eczema, like these sort of chronic illnesses that they can do bits and pieces and they can help symptoms, but to get to the root of the issue and make a gradual improvement in a person's overall health and well-being that holds, it's really special. Yeah, I love it.
Oh, wow. Well, it's certainly been interesting, as I said earlier, working with you and finding out about this has just been fascinating. So tell us now about your hopes and dreams for the future. So where do you want to go? You've got some skills now. You've been doing some studying and you're starting to put that into practice. You've got some clients. Where do you want to go with this?
Oh, Deb, I just want to be a great therapist. I really, I'm quite determined to do what I need to do and to do what I can to be an excellent therapist that can help anyone who wants to walk through my door
Yeah.
get to their healing best, or their physical and mental healthiest, using this technique. Because and look, it has to be supported with other things. You can't go and eat McDonald's for breakfast, lunch and dinner and expect biomagnetism to work miracles. It will definitely help, but we also have to be realistic about our lifestyle and our choices as well, to a degree. And that's another thing biomagnetism is wonderful for. We have the ability to resolve emotional conflicts that we may have taken on at this or that point in our lives that can impede our healing process. So, and there's always going to be at least one emotional conflict when it comes to things like cancer, these sorts of big complex issues. There's got to be an emotional part to play. So having the ability to clear these things and help people return to a level of optimal health that's my passion. That's where I want to be. That's what I want to be doing until I can't walk anymore.
Oh, look, and I can hear the commitment and the dedication there, and the passion, I probably want to say. What is possible, do you think, with this? Like, just given your experience so far, what is possible?
A really high level of healing.
Okay.
It is really definitely possible. And there are hundreds, if not thousands, of testimonials from clients all over the world that are genuinely surprised by the level of improvement they've got from using biomagnetism. From kids with autism who weren't talking, who spoke words in the car on the way home, to, people with arthritis, huge improvements, obviously cancer, eyesight, skin issues. The list goes on. Look, we have to be realistic. It's not going to work like that for every person. Not every autistic child that walks in your door is going to walk home more able to.
Verbal. Yep.
Yeah, it's just we have to be realistic, but these sorts of things can happen. They can happen. And I think what I would love to be doing moving forward is to do my absolute best to ensure my clients' absolute best is possible for them.
Yep.
So often people come to us as a really last resort. I've tried naturopathy for years. I've thrown all this money at that. I've thrown this money at that, and it worked a little bit.
Yeah.
And so they come and expect a miracle.
Okay.
Because they've heard this thing, it's biomagnetism, it'll solve everything. And look, yes, I do think it is an extremely effective technique.
Yeah.
But we also have to be realistic that it may not be the be all and end all for everybody. But in my experience so far, it's been the most profound healing technique with no side effects. You don't, you just place the magnet on top of your clothes for 20 minutes, depending on where you are located, and then you hop up and walk out. It's a beautiful technique. You go through it takes about an hour.
And so no discomfort, no pain, none of that.
No needles in you like acupuncture,
Okay, so you just chill for an hour or so. And
most people fall asleep. Yeah.
Because
I feel like I haven't done a really good job if people don't at least really, really relax.
Yeah,
Oh, they didn't get a rest.
A beautiful meditative state, and then you're having healing at the same time, and probably being in that, nice relaxed state probably helps, I'm sure.
Oh, yeah, absolutely. And look, people will often sit up and just feel, so light. I've treated people with shoulder pain or, upper back pain, and they've stood up and they've gone, oh, that pain's gone.
That's amazing.
It's a fabulous technique. And I just love it. I'm very passionate about it. And I'm hoping with this book that we can get the word out there. So people can access something it's comparatively low cost. It's also actually able to be used with all of people's conventional medicine, except for chemo and radiation in that first 12 months. So you can have it with your blood pressure medication. You can have it with anything, you know, which makes it's just so versatile and supportive.
Wonderful. Well, that brings me to ask you, where do you practice? Do people have to come to you?
People can come to me. I live in Nunda in Brisbane, and I've got a beautiful setting out the back with some trees and birds, and also I can provide distance healings. So I've actually been treating some people in the States and another person in India most recently, and I'm also starting to treat animals. I've treated a couple of cats lately. There was a cat who is on her, bless her little soul, on her deathbed in the vets, and she did get some other healing therapy, I believe, some Reiki or some, can't remember, not sure. Some other, and I treated her with biomagnetism from a distance, and she's now at home doing great. So cats are really fun to treat, actually. I've never owned a cat, but you know, they're so full of personality. I treat my own dog quite often. I don't put the magnets on her. I put them on myself as a surrogate for her, because she's a puppy, she'd run away or shake them off. But so I have seen some dogs that just love having the magnets on them. They just lie there and
isn't that cute?
But yeah, so look, it's actually quite a versatile therapy. You can use it for animals as well as humans, in person or via distance. And sometimes, you know, you can use a parent to surrogate for a child as well. You know, if you've got a toddler or a baby, because we use the legs to test. So our bodies, the right side of our body will shrink when the magnet finds a place of imbalance, and that's how we can see whether there's an imbalance there. So it'll sort of, the right leg will shorten. Well, it's the whole right side of the body, but it's the right leg will shorten by,
that's how you see
between 1 and 2 centimeters. And so then you find the corresponding pair. So if there's a baby that's not well, you know, mum hops on the table and connects through their relationship with the baby, and you treat the baby via mum.
Rosemary, this has been fascinating, totally fascinating, and I'm even more curious now than I was before with reading the book. Can't wait for, as you say, for us to get this book out there. Where can people find you and find the book? You have a website?
Yes, website's best. So it's biomagnetismhealing.com.au.
All right, so it's www.biomagnetismhealing.com.au, and people can reach out to you there, email you with any questions, find a contact point to make an appointment, and take it from there. So I'm very excited for you, and I think it's just such a beautiful project with some great possibilities for helping people in the future. So well done, and congratulations on finishing the book.
Thanks so much, Deb.
All right, so that's it for today's episode of The Disruptive Author. It's been lovely to talk to you, Rosemary, and we'll look forward to catching up with another episode in the very near future. Bye for now.